What is your name and where do you work?
Okay, my name is Mary Lambert. I'm a respiratory therapist, and I'm a lab assistant here at Brookdale Community College in the respiratory therapy program.
Have you ever worked in the hospital
I have.
respiratory?
I've worked at Monmouth Medical Center for, I'd say, about 20 years as a respiratory therapist. Prior to that, I was in LPN, and I also worked at Monmouth Medical Center.
What was your scope of practice there?
In Monmouth Medical Center, the scope of practice for the respiratory therapist is one of the things we do is give breathing treatments to those people who have difficulty with breathing, like with asthma, COPD. We give them inhaled medication to help open up the airways to help them breathe. We draw blood gases from an artery. We have blood gas machines right in the department. Instead of sending them to the lab, we analyze that blood to determine how much carbon dioxide and how much oxygen is in the patient's blood. We do incentive spirometry, which is helping the patient to take in nice deep breaths so they don't develop pneumonia postoperatively. We do chest physiotherapy, which is a way of loosening secretions to help patients cough it up. It's a physical kind of beating on the chest kind of thing, and we also utilize a vest that wraps around the chest and other modalities to help them mobilize secretions. We do intubation, which is for patients who can't breathe at all. If they've had a heart attack or stroke, they've been in some sort of trauma, we assist the doctor in putting that tube in. And in most hospitals, we actually do that, put the tube in. We also are responsible for the mechanical ventilator, which we then attach those patients to actually breathe for them for a period of time, as well as doing non-invasive ventilation. I know if you've heard of CPAP, BiPAP.
Yeah.
Have it in the hospital. Some patients have it at home. We're responsible for the care and feeding of that machine. We work from the neonatal community. We work a lot in the neonatal intensive care for the preemies or babies who are born some kind of stress that have to be on mechanical ventilators, that need some kind of respiratory care. We work in the adult intensive care, doing the same thing, do a lot of in the pediatric unit. We go to every code blue in the hospital, as far as all of the rapid responses. We do most of the oxygen modalities. If patients need supplemental oxygen, we usually will set that up. Quite a bit.
That's a lot. What was your aha moment that made you want to go for respiratory?
Say that again?
What was your moment where you said, oh, this is
okay,
what
like I
want
said,
to
I
do?
started out as an LPN, and my original goal was to come back here to Brookdale to get my RN. But when I found out what the respiratory therapist actually did, I actually followed one around for the day to find out what their scope of practice was. I decided I would like that better. So mainly because we do work all over the hospital. One day I could be in intensive care, the next day in the emergency room, the next day in the NICU. We work with a lot of machinery, so I found that a little bit more interesting.
Let's see.
Do you have an answer? What's the level of education needed for this?
Entry level is associate's degree.
Okay.
But NBRC, which is our credentialing exam, is now trying to push us to go for our bachelor's, but most of us have associate's degree, which is entry level for us.
And that's also the license requirements?
That is a license requirement, and we have to sit for a credentialing exam, actually two credentialing exams. One is simply a multiple choice, and then they do one called a clinical simulation test, whereby they give us patient scenarios and we have to come up with the correct answer. Besides having that, we are required to have BLS, basic life support. We are required to have ACLS, advanced cardiac life support. We are required to have NRP, neonatal respiratory protocol, and PALS, which is pediatric advanced life support. So we are required to have all of those credentials.
Wow. What did you learn about this career that you did not know before going into this?
What did I know about it before going into it? Like I said, I researched it pretty well before I was already
You
an
did your
employee.
homework, right?
Yeah, I
Before
was
going into
already
it.
an employee in the hospital, so like I said, I followed a respiratory therapist around to find out exactly what they did, and then I did a little research on my own. So,
Best way to do it.
yeah, so I pretty much knew what to expect when I went into the field.
Did you run into any obstacles while you were trying to pursue this?
Either in like family, financial.
Yeah, this is a very intense program. And I did have 3 small children at home and my husband, and I was working as a nurse as I was going to school. Fortunately, Monmouth Medical was very lenient, and I was able to work part-time and take time off for classes, but it was an obstacle finding enough time in the day to, when you're trying to work and raise children, to also find time to study.
Mm-hmm.
In this program, there's a lot of reading and a lot of research and a lot of physical hands-on that you have to physically do here at the lab, which requires a lot of time away from your family.
Yes.
Do you have any advice that you would give anyone going into respiratory?
If you're going to go into this field, I would advise you to do your prereqs prior to coming into the field, because I said it's a pretty intense program. And the prereqs and the coreqs, it can be done together, but it's really intense. So I would recommend you do that before coming into the program so that you can concentrate just on respiratory once you get into here.
And how do you cope with stress? Speaking, I know you were just talking about how stressful it can be. How did you cope with that when you were going to school, or even during your career?
Oh, I have a lot of ways. I could always find someone that I could talk to. One of my ways of dealing with stress, any kind of stress, be it personal stress at home or anywhere, I like to walk. Get out and I just walk and I think to myself and I try to cope with all of my problems that way and just find somebody that I can kind of unload on and get it off my chest. That's the best way I can cope with it.
Oh, that's perfect.
Yeah.
Do you have any long-term goals? Like, what are your next steps after this?
Actually, my long-term goal is to retire. As I said, I worked at the hospital already for some 20 years. Then I spent several years working both at the hospital and here, doing part-time at one, per diem at the other, and then was offered a full-time position here. So I'm pretty much, I had to get a bachelor's in order to get into this work here. So at this point in my life, I am not going further. I'm just now looking to finish up working my few years and retire.
Okay.
Do we have anything else that we'd like to ask her?
I think you pretty much answered all our questions.
That's it?
Yeah.
Yeah, thank you so much.
Thank
Well, that didn't
you.
take
Really
long
do
at all.
appreciate it.
Thanks.
I'm gonna just pause that.